Welcome back to Get Connected. I'm your host, Con Jackson. It's now time for our segment we call Health Beat. This is where we keep you alive and vibrant, and today we're talking about the heart and how cholesterol affects it. Joining us is a world-renowned doctor, Dr. Robert Kloner. Welcome to Get Connected.
Hello, Con.
Doctor, what is it about the heart that has drawn your attention?
Well, the heart to me has been a very interesting organ. One, it's got moving parts. But I think more importantly, the advances that have been made in heart disease, especially over the last 10 to 20 years, have made it a great area to do research.
And doctor, why is cholesterol in particularly important to you?
Well, high cholesterol is one of the major risk factors for cardiovascular disease, including heart attacks and strokes. And millions of Americans are on medicines for high cholesterol, including a group of drugs called the statins, when exercise and diet aren't enough to get the cholesterol under control.
And in this case, what does the medication actually do?
Well, the statins reduce the total cholesterol, and they also reduce the LDL cholesterol, which is the bad guy. That stands for low-density lipoprotein cholesterol. And studies have shown that when you reduce LDL cholesterol with statins, you can reduce major cardiovascular events, including heart attacks and strokes. So these drugs have become a very important group of drugs in the armamentarium against heart disease. Now, one problem that has arisen is that recently the FDA announced restrictions concerning one of the now generic statins called simvastatin, especially at the high dose, where there's limitation of its use, especially, again, the 80 milligram dose, which is the high dose, is no longer suggested to be given as starting therapy for patients, and patients should only stay on it if they've been on it a while without any muscle problems. And the problem has been that at the high dose with simvastatin, there's more muscle problems, including muscle tenderness, weakness, and breakdown of the muscle itself. There's also some issues with drug interactions between simvastatin at lower doses and other drugs. So this has been an issue that was recently raised.
And doctor, what is the call to action for us today?
Well, I mean, if they're on simvastatin, they should probably just speak to their physician in terms of whether they should stay on it or not. It may depend on what other medicines they're on. Again, if they've been on 80 milligrams of simvastatin and have not had a problem with muscle pain after they've been on it a year or more, then they could probably stay on it. But it's something they should discuss with their physicians. The other thing is that I'll mention is that I think there are other therapies and other statins besides simvastatin. And one of these therapies is going to be going generic starting in the end of November of 2011, and that's Lipitor, which is another very powerful statin. It's been around for a long time. It's known to significantly reduce the LDL cholesterol, and in several large clinical trials, it was actually shown to reduce the incidence of heart attack, stroke, the need for certain kinds of cardiac surgery, and angina in patients with heart disease or risk factors for heart disease.
I'm curious, doctor, is the only place we get cholesterol from what we eat?
That's part of it. So you get cholesterol from a couple of sources. One is your diet, but the other is that your liver actually makes cholesterol. So what the statins primarily do is they decrease the production of LDL, the bad cholesterol in the liver. There are other medicines which prevent the absorption of cholesterol from the gastrointestinal tract, and these include drugs such as Zetia, for example.
Certainly interesting, doctor. And when it comes to our overall health, what are some things we should consider?
Sure. Well, I think diet and exercise is where we would start. And we would start there even before medical therapy. And some patients are actually able to get their cholesterol down and their blood pressure down with diet and exercise. If diet and exercise have been tried and aren't capable of getting the cholesterol down to the levels that we'd like to see it, then I think it's important for the patients to go and speak to their healthcare providers and find out what other options they can get, including medical therapy.
Well, doctor, thank you so much for your time and your passion for the heart.
Thank you so much for having me on your show.
Got to keep the heart healthy so you can be around to watch the show. That's what I say. At any rate, we'll be right back with more Get Connected. Thank you so much for watching. Are you tired of negative news? We are.
And that's why we're creating a movement.
By keeping it real.
With what you need to know.
It's more than what's happening.
It's bringing hope back to our lives.
So go to contv.com and join our movement.